The aim is get the patient in the centre with the care around the patient of different social services and community care and GP all working together. One, getting more easier access to the patient.
It's really trying to prevent patients going into hospital unnecessarily. So having that wraparound team at home, we cover 24 hours a day.
Well, I can speak to them if anything goes wrong. Like, you know, they're very good. They are.
In the past, they would very often go to the GP and ask the GP for a referral.
Which may take me an hour sometimes to sort it out. Now a single phone call to the neighbourhood team, and that's being dealt.
So there's a lot more communication between teams that were previously separate. So we're all in one place and we see each other regularly every day and we can talk easily about that patient.
We understand each other's services better, so we can cut out the duplication.
We're a lot more aware of other patients in other teams, so at weekends and things, so we're more aware of patients with potential problems. It's definitely worked a lot better. As we're working across the board more with sort of not necessary to our own surgeries, so it has to work really, so communication's definitely got better.
The communication happens between the services rather than going back to the patient all the time.
Working with GPs, we can make sure that we do get the right person at the right time in the right place, which is what we want for our patients.
Cutting down the number of visits that need making by making them all more effective.
Like the nurses are coming and they text me my bottom and all that, you know, and make sure my seat's all right.
Whether it be a nursing need, a problem with mobility, a need for equipment, they can all come in through the same phone number. They're dealt with on the desk and then that work is allocated out to the most appropriate professional group really.
Members of the public, family, friends, anybody rings the number. They ring with a variety of questions. Some only ring for a telephone number for access to other services, and some require my skills to actually go through what they need and find the right person to go in and solve their problem.
We can keep that patient at home, prevent those unnecessary hospital admissions and long waits on hospital beds.
So I've got lots of access to different professions that I can bring in to help solve the situation and hopefully return their life back to normal.
And to make their environment work for them really, with whatever individual equipment and strategies, advice will actually help them to have a better quality of life.
But with this new creation of neighbourhood team, I think the best way to put it is the right person to see the right patient at the right time.
Patient-centred.
Committed.
Caring.
Safe.